Okay, so hi everyone. I'm Dr. Deepa. I am the founder and academic director of Dr. Deepa's Learning Launch, and I am also the co-founder and the lead for the Global Ambassador program of PathIQ. So there are a lot of students who are very naive and new to AI in digital pathology, and a lot of seniors who've missed out on this. So I just wanted to do from the basics to the advanced level of AI in pathology. So in view of time, I will be dividing the whole talk because it's a very detailed course. So I will be dividing the whole talk into 10 episodes. So we will start with the basics today, and then we will go into the details of computational pathology in my later episodes. So this is the first episode out of 10 episodes on AI in digital pathology. So welcome first of all, and this will be a master class. And on the basis of this, we will see how the digital workflows happen in an AI laboratory, how the ethics, implementation, and the future of diagnostics will change on the basis of what AI is doing to digital pathology. And here I will also in the series provide you insights that you can apply in your own practice. So let's begin. So first of all, it's a pleasure to speak about one of the most important transformative developments in modern pathology, which is artificial intelligence. For decades, pathology has remained as a gold standard for disease diagnosis. As you know, pathologists are irreplaceable, and you will not be able to do any diagnosis. No clinician can actually perfectly treat a patient unless they have a pathologist who is working in the background and helping him diagnose the case, correct? So while radiology has rapidly embraced digital technologies in the last few years, you hardly see any radiologist working on a routine X-ray these days. Everything is on the AI-based generation of the image. So the contrast is better, the look of the image is better, the field of view is better. They can increase the clarity, decrease the clarity. So that has happened almost a decade ago, but we are a little behind time on this. So while rapidly radiology has embraced the change, pathology has continued largely on glass slides and on conventional microscopy in many countries. Even now, there are smaller institutions that still don't use the whole slide imaging. And to my knowledge, there are nearly 60% to 70% of the labs, even today in India, which have not adopted the AI and digital pathology yet. So the landscape is continuously changing. So artificial intelligence is no longer a futuristic concept. It is reality today. If we miss the bus, we miss the bus. So it's becoming an integral part of digital pathology and influencing how we diagnose a disease, how we conduct a research, and how we improve workflow efficiency and ultimately deliver better patient care. Suppose you are a pathologist who is working for, let's say, in a CRL, where you are working with 10 other laboratories who are referring cases to you, they're sending you slides to you, and you have a cumbersome, excessive work that you have to deal with, then certainly, unless you have an AI that is helping you diagnose, it is going to become more and more cumbersome for you, because right now we are at a place where the amount of delivery that you give out is also gauged. So that is the reason why you need to adapt this. Sooner or later you have to adopt this. AI by far should not be viewed as a replacement of a pathologist for sure. It should rather be looked at as a powerful assistant that augments the capabilities of a pathologist. So it helps us analyze the vast amount of complex information in a very efficient and way, so that we can identify even the subtle patterns that are otherwise overlooked by a pathologist because of workload. And if you integrate pathology findings with genomics and radiology, the clinical data to support precision medicine will be of a great deal of help in future. In this presentation, I will discuss how AI has become very important in clinical and research applications, and how successful is the AI project when it develops in the personal challenges of implementation and in the professional challenges that the laboratories have. And I believe that the future of diagnostic pathology is heading towards AI only. More importantly, I would like to look at this as beyond an individual AI algorithm. I am envisioning this as an integrated digital pathology ecosystem that our technology and pathologists have to work together to improve patient outcomes, whether it is today or whether it is a year later or 5 years later. You have to adapt to whatever is the AI. So before we discuss specifically what AI applications are, it is important that there is one fundamental question which you have to answer. Why is AI becoming relevant to pathology today at this point of time? The answer lies in four major challenges that are changing, and those changes are there in our profession. The first driver is explosion of data. Pathology today extends far beyond the HND. It is not just the HND slides that you're looking at. It used to be just HND slides where you used to give a provisional diagnosis, but now it's far ahead of that. We now routinely work beyond HND. We look at the immunohistochemistry, we look at the digital whole slide image, we look at the multiplex immunofluorescence, we look at special transcriptomics, we look at proteomics, we look at molecular diagnostics, we look increasingly in multitude of data sets. So just for a diagnosis, let us say there is some growth disorder in a child. You just can't rely on one liver biopsy that you get. You don't rely on just that. You rely on a lot of multitude of data. So that is why there is too much of pooling of data. That's the first trigger for AI development. Then second is each patient generates far more information than it used to before, correct? So right now that is the challenge that we have to look at. Then it is becoming very unrealistic for an individual pathologist to manually extract each of these clinical meaningful patterns and complex data sets to give a proper diagnosis. Now, if you don't have, let's say, there is no workflow in your laboratory where all of these come under one carpet. Suppose you have to go from here, from your laboratory to the geneticist today to discuss a case. You have to pick up a call and look at the data that the clinician is giving you. Then all that is a cumbersome thing. If there is AI that is already taking a part of this whole thing, then everything will be at your desk. In one go, you will be able to look at everything there. Okay. So when you look at this whole thing, then what you will be able to also see is that the extraction of the data through multitude of places becomes very easy for you, right? So the clinically meaningful pattern of complex data sets is something that you will be able to look at very easily. The second driver is a global shortage of pathologists. There are some places which are blessed with a lot of pathologists, but there are a lot of places where there is less number of pathologists. Many countries are experiencing an increased workload alongside a decreasing pathology workforce. The number of cancer cases continues to rise while the diagnostic expectations are becoming more and more complex. There are very little people who are actually able to take care of this whole thing. AI cannot replace a pathologist, but it can reduce the repetitive tasks and it can prioritize the urgent cases. It can assist in the screening. It can improve the workflow efficiency, and it allows the pathologist to focus on the high clinical value and decision making for sure. So that is a very, very important thing that you have to look at. That this will help you as the second, this is the second driver that has caused you to adapt to AI. The third driver is the need of an integral diagnostics. Historically, pathology used to be a function somewhat independently from the radiology genomics and somewhat different from the clinical perspectives. But in digital pathology, we now have an opportunity to integrate the morphology with imaging, the morphology with the biomarkers, the morphology with the laboratory data that is available, the morphology with the clinical information in the same desk. So unless you are actually confident doing these things together, it is not a holistic diagnosis of the patient, and people no longer want a piecemeal diagnosis. No patient is having the time today to go once to the pathology lab, to go to the clinician another day, to go back to laboratory reports one more day, wait the whole time, and keep looking at these doors again and again. You and I also hate it. So that's the second driver why we go into AI and digital pathology. This moves us closer to a truly personalized medicine kind of a scenario rather than reviewing information and in isolation. So the AI enables us to contribute multiple data sources into a unified diagnostic framework. So that almost always creates a virtual multidisciplinary tumor board for every patient. That is the most important thing. That is the third driving force. The fourth driving force that we are looking at is also very important. That is another thing that moves us very, very closely to the quality and the effectivity of each of your diagnostic. The fourth is the quality, the standardization, and the efficiency of your work. See, let's assume you had a hard day and then you are back to your laboratory. You don't have the intent to miss anything. But if there is an AI assistance, even at the worst times when you are actually really low on that day or really worked up with too much work, also, the possibility of you missing out a finding is nearly zero. That is another fourth driver. So even an experienced pathologist can have an inter-observer variability in the grading. All our labs, when we are doing the NABL assessment, suppose, we always look at the inter-observer variability data, isn't it? So when we're looking at an inter-observer variability data, it is very, very important that you have this data. Why are we having this data in inter-observer variability? Because in most likelihood, you should have the same report generated for the same slide. But there are chances where an inter-observer variability can be there. For example, let's say you had a microfile area. One microfile area larva is somewhere at the tail end. One pathologist who is too worked up is looking at the data, and then suddenly they miss out looking at the tail at one point of time. And the observer just gives eosinophilia. One observer gives microfile area. Isn't that really bad for the patient? That changes the entire scenario. Eosinophilia will not be treated in the same way as having microfile area. The treatment changes drastically. You cannot afford to have an inter-observer variability. But suppose it's a whole slide image. You have such a small whole slide image in when it is zoomed out that you can possibly never miss that microfile area, because your whole slide image starts from the scanner view itself, or much below the scanner view actually. So that's how much a difference it can make in your workload. So AI can improve the reproducibility of the report by applying standard algorithms. It can give you a diagnosis even before you look at the slide, and it reduces the turnaround time also, and it minimizes the manual errors like the example I just told you. So taken together, these 4 or 5 drivers explain why AI is no longer an optional technology, and for pathology departments, it is becoming almost mandatory. If you don't adapt to it, you will miss the bus. It is becoming an essential tool. One thing is, it will reshape our pathology practice soon. And in coming years, it will definitely make a major change. The question is no longer whether AI will become a part of pathology. The real question is, how are we pathologists, how are we responsible for its adaptation and adoption in our clinical practice? Okay. So to truly appreciate the artificial intelligence, it is helpful to understand how pathology has evolved over years. From more than a century, the pathology relied on examination of the glass slides. What the glass slides is something that we've done over years. I still love to look at my slides under the microscope, but the traditional approach remains the cornerstone for diagnosis, but it continues to be indispensable too. However, it has some inherent limitations. One thing is, glass slide can only be used at one location at one point of time. Let's assume I have a patient here. I will tell you my experience. So I have closely worked with a couple of patients with having a skin disorder here, which was doubtful to be a malignant melanoma. It was not clearly a malignant melanoma, but the whole slide image of the same. I had a second opinion booked for the patient by a very famous dermatopathologist in US whom I work closely with in my experience. I could do that because it was a whole slide image. You think it's actually possible to pick up a glass slide and then pray to God that it doesn't break by the time it reaches US? And how long does it take? This takes a jiffy. I email him, I'm done. But if I want the same thing to be done by the conventional method, it's nearly impossible. So that is where it forms a change. The glass slide can only be viewed by one person at one location at one time. And the collaboration is often constrained by the physical access. The quantitative analysis depends heavily on the individual's interpretation capabilities and the experience of the person. But the first major transformation of digital pathology actually came when whole slide scanners came into picture. The whole slide scanners now enable entire tissue sections to be converted into high resolution digital images. So these digital images can be stored, it can be saved, it can be reviewed remotely, and it can be shared right across the globe wherever the Wi-Fi is available, correct? So that makes your life so much easier to take a second opinion if the patient is willing for it. Correct? So that is another system that makes access to any other pathologist anywhere in the world to look at your slide. That is a gift. And then we can deliver the clinical care accordingly. The next stage of this evolution was beyond digital pathology, which is artificial intelligence. So what is an AI? AI allows the computers to analyze the digital images, in ways that are beyond single image viewing. There are algorithms that are dedicatedly made and corrected and solved and validated by pathologists in multiple places, who identify the cells, who detect the tumors, who count the mitotic figures, quantify the IHC markers. They access tumor cellularity, and this entire thing is done as a very religious way, so that the AI is completely trained and ready for use. Once it's ready for use, all of this is done like magic by the AI. So it even recognize, once the AI is ready, it does everything for you. It checks the cells, it identifies an abnormal cell, it detects a tumor, it will count the mitotic figures for you, it will quantify your IHC marker, the percentage, whether how you want to give it as 1 plus 2 plus, or you want to look at the tumor cellularity. It will give you a clue. Where is the tumor? Where is the cellularity? There will be hotspots that are generated. There will also be a morphological pattern that it can pick up, which can be slightly inapparent in the early cases. Those also can get picked up. The ultimate goal of AI is beyond the isolated algorithms. So now, beyond the AI is what? Beyond the AI, we are doing something else now. What is that? That is computational pathology. What is a computational pathology? Computational pathology is where tissue morphology is clearly integrated with molecular pathology, with genomics, with radiology, with laboratory medicine, with clinical information, and you get an in toto picture. That is computational pathology, which has gone ahead of AI also. AI enables us to combine all these data sets into a comprehensive understanding of the disease. That is where computational pathology is today. So this integrated approach basically supports what is called a precision medicine, where the treatment decisions are tailored to a unique biological characteristic of the patient's disease. And as leaders in pathology, our role is not to adopt to digital tools, but to guide this transformation effectively so that our workload comes down. Pathologists definitely will still remain the center for the diagnosis, because they are the ones who are training the AI, they are the ones who are validating the AI, they are the ones who are using it for us. Unless your sign off is there, it is not a report, it will not replace you, but it will only ease your work. At one point of time, even using computers was a luxury. Now it is no longer a luxury, right? Everybody has a computer, everybody is still using internet. 10 years ago or 20 years ago, did we even imagine that we will be using mobile phones in many different ways that we do today? We didn't. But today we have to go far ahead of this, and all of us have to join hands in doing this, because although a pathologist remains central to the diagnosis, AI serves as an intelligent partner for you that enhances your accuracy, enhances your efficiency, it enhances your ability to generate clinically meaningful insights. And to emphasize, digital pathology is the foundation, artificial intelligence is the engine. That is how you understand it as. Computational pathology is the destination that we have to reach. Radiology underwent this entire digital transformation nearly 2 decades ago. Pathology is now undergoing a similar evolution, and an even richer biological information embedded within every image can be picked up by AI. Okay. Another thing is, one of the biggest misconceptions about artificial intelligence is that a single tool designed to make diagnosis independently is what they used to think. That is not what it is. In reality, AI has the potential to assist us at almost every stage of pathology workflow. It is not only something that is reading your slide. That is not how it is. It begins even before we review the slide. AI can help us in prioritizing an urgent case. Suppose you have a workflow in your LIS that is telling you which is an urgent case and which is not an urgent case, then AI can help you prioritize it. You have a workflow, you have to rely on your technician saying 3 days old case, which your tat is 3 days for a particular small biopsy, your tat is 7 days for a larger biopsy, your tat is, let's say, 10 for a extended biopsy. So in these cases, you have to rely on your technician. Today he says, ma'am, main bhool gaya, I forgot, I totally forgot that was due for today. I'm sorry, I forgot about it. What will you do? The patient is not going to wait. So AI begins its work. AI, when you're adapting AI properly, it can begin its work even before you look at the slide. It can actually make your workflow better. It can prioritize your cases, which is urgent, which is not urgent. That is one thing that it can help you. So once your prioritizing is done, this allows the laboratory to triage the whole workflow. It will be more efficient because that your turnaround times will never get missed. Once the slide is digitized, the AI can perform quality control. In the sense, it can detect an out of focus image once the whole slide is already there with you. At the time that AI wasn't there and it was only digital pathology, each of these whole slide images used to be validated by the pathologist. You and I have to sit down and see, see, you haven't scanned this properly. Please clear the lens again and let's do it again. And the images are not coming too well, or the images are not getting zoomed out too well. The clarity is low. Please again go ahead and rescan it. These used to be the work of the pathologists who were adapting the digital pathology. But now AI can actually reject these cases in which the whole slide image is not clear. It will just not take it in. So that is called a clear quality control in which the AI can help you detect an out of focus image or tissue folds or a cutting artifact or some scanning artifacts or some knife that is blunt and the sections are not taken too well, the slide itself is not good. So all of these quality control checks can be integrated to AI. So the AI will not make you work on that also. These issues, once they are identified early, you don't have to waste your time on repeated reviews, and your tag delays need not be explained to this, right? So it starts your work right before. One is it helps you in prioritizing and triaging your work. You know which one to see first, which one not to see first. Then you have this quality control that your whole slide image is crystal clear once AI is integrated. And the next stage involves the tissue and cellular analysis. Once there is a tissue and cellular analysis, the AI algorithms can identify different tissue components and recognize the lymphocytes or plasma cells, necrosis, fibrosis, what have you. It will recognize on its own and it will tell you that this is the histological feature, right? So AI is also increasingly used for tumor segmentation, accurately outlining the tumor regions, separating them from the benign tissue. That is one thing that AI is already integrated in doing. So this particularly is very valuable for quantifying the biomarkers or selecting the regions for molecular testing. One of the most mature clinical applications that AI does now, very important, is a biomarker quantification. AI can produce a standard scoring system for immunohistochemical markers such as ERPR, HER2, Ki67, and PDL1, etc., so that you don't have to do that mechanically. It is already telling you the scoring. So your work is completely minimized. You just have to work on releasing the report after what it is telling you. Revalidate that and release the report. By reducing this, once this number is already done by the AI, once you open the whole slide image and then you are picking up these spots and then you are telling it to quantify this, there is a number that it is giving out. And that number definitely is the same that you and your other pathologists are looking at. Okay, so the chance of an inter-observer variability is come down very much, right? Because the AI is already giving it to you. All that you are doing right there is yes or no. So the inter-observer variability and the chance of you missing out something is far lesser when there is an AI partner with you. And another thing that it helps in is beyond diagnosis. It contributes to the tumor grading and tumor classification. It helps in identifying the histological subtypes and estimates the tumor burden and supports the risk stratification, which is the most exciting development of AI, and to integrate the pathology findings with genomics, radiology, and clinical information. So it gives you a holistic approach. Rather than acting as an isolated tool that is looking at an image, AI becomes a clinical decision support system that contributes to a complementary patient management. So your entire patient management is now in your fingertips. So it is also important at this point that I have to emphasize that throughout this entire workflow, the pathologist remains the final decision maker. There is no look back on that. There is no change in that. The pathologist is the final decision maker. But AI provides a quantitative analysis, it highlights areas of concern, it assists in interpretation, it assists in clinical judgment, it gives you a contextual understanding, it gives you the responsibility for diagnosis to continue to rest with the pathologist. So don't even think that AI can replace pathologists. It does not. The future, therefore, is not AI versus pathologist. The future is AI enabled pathologist who delivers better, faster, and more consistent patient care than the people who have not adapted to AI. So the greatest value of AI is not replacing an expertise. The expertise that lies with the pathologist is still with the pathologist. Nothing changes there. But it amplifies your expertise, it amplifies your work level. If AI can support every step in the workflow, then where do you think that it delivers greatest value today? In my opinion, it is not replacing the diagnosis, it is just eliminating your repeated redundant tasks and frustration that we have on regular basis. Today, if my in my workflow my technician forgets something, the clinician will call me and say, oh, chalo, I gave you that day this particular slide, you haven't done it yet. I am frustrated. I will try to expedite it. It can get processed well. It may not get processed well because I'm bulldozing that today. And then there may be some whole slide image that is not scanned well, and I there's nobody who rejected it. The technician forgot to reject it properly. Then I have to redo that. So these repetitive, redundant things that I usually do, that any pathologist is frustrated about, is certainly something that AI can eliminate. So it is your partner that will help you do better. So that's why I said this is the entire workflow on your screens. Whatever you're seeing is the entire workflow where AI can work for you. Another thing is, what are the clinical applications of AI in digital pathology? So in AI, one of the strongest arguments for adopting artificial intelligence in pathology is that many of its applications are no longer theoretical. Several AI tools are already in the market. They are demonstrating significant clinical value. Perhaps one of the most widely studied application is the detection of lymph node metastasis. You can see a whole level of papers that are giving you detection of lymph node metastasis by AI. You have so many papers that are released. It's one of the best things that are published. So screening lymph nodes, particularly in cancers such as breast and prostate, is a very time-taking, cumbersome task. And also if it is GI also, it's a very cumbersome task. So a small metastatic deposit, especially a micrometastasis or an isolated cell that can lie in your biopsy, can be missed by you, but it is not pardonable. AI algorithms can help you in rapidly screening these digital slides. It highlights the suspicious hotspots. It directs the pathologist's attention towards something that requires a closer view. This improves the sensitivity while reducing the screening time. And also the major application is tumor detection and segmentation. AI can accurately distinguish the tumor from the surrounding benign tissue, which your naked eye may miss sometimes. And it can delineate the tumor boundaries better. This is particularly useful in estimating a tumor burden and planning molecular testing or selecting a representative region that is best for your additional investigations. Because even when you're doing an IHC or even when you're doing any of your other testing that you're doing on your tissue, you have to identify a perfect area for that. Otherwise, it is futile. So in that also, the AI will help you. It also performs exceptionally well in a mitosis detection. Mitosis detection is a time-consuming, cumbersome, difficult process when you're looking at malignancies day in and day out. And there is a considerable inter-observer variation. Mitosis detection is the worst in the inter-observer variation, that many times the acceptability of inter-observer variation goes hunky-dory when you're actually doing this, and two pathologists almost never reported perfectly at the same level. So that is where an automated mitotic counting improves the reproducibility and provides an objective quantitative data that supports the tumor grading perfectly. Another important thing where AI will assist is a tumor grading and classification. If you're analyzing the architectural patterns, let's say for prostate, then you are looking at the nuclear morphology, you are looking at the histological feature. Then in this also, the AI can support in the grading systems because you've already fed it, you've validated it, your system knows how to grade it. Then it picks up very well and it reproduces the same data properly. And these tools are very important for decision making. Particularly, there is one more mature application in which AI works, which is immunohistochemistry quantification. Biomarkers such as ER, PR, HER2, Ki67, and PDL1 require a very, very accurate, reproducible scoring, because that is also important for the patient management and for further treatment. Correct? So your ER, PR, HER2, Ki67, PDL1 has to be perfectly correct. So AI offers a standard assessment which helps in reducing variability between observers and between institutions also when you're looking at these gradings. Then one more very important thing where we all have a problem with is tumor cellularity estimation. So estimating the percentage of the viable tumor is essential for molecular tests. So AI will provide an objective estimate that can improve the consistency and reduce the sampling errors. That is another area where AI will help. So beyond diagnosis itself, AI contributes significantly to the quality assurance. Algorithms can identify blurred images. Algorithms can identify tissue foldings. They can identify incomplete scans. They can identify staining artifacts. They can identify technical issues before the slides are reported by the pathologist. So you don't have to do redundant work there at all. Then detecting these problems early will also improve your efficiency, and it will reduce repeated work. And taken together, these applications will demonstrate that AI is not designed to replace the expertise of pathologists. Instead, it helps you as a partner to ease and make your life better. Okay. So as we come to the end of today's session, I hope the message stands out very clearly. This is the introductory first episode. We will go into details of AI in each of our episodes. So here the message I think stands clearly that artificial intelligence is no longer a concept for future. It's becoming an integral part of the present and future of pathology. Rather than it replacing pathologists, AI is providing us with a powerful tool to improve our diagnostic accuracy, to enhance our efficiency, to uncover new biological insights here, and to ultimately deliver better patient care. That is our ultimate goal. Today we have explored why AI matters, the force driving us to this adaptation, and why pathologists should understand AI, and how this is a rapidly developing event which we have to adopt to. But this starts with curiosity, and I hope today's discussion has inspired you all. This is only the beginning. In our next episode, which is AI beyond diagnosis, we will move beyond the headlines of what we looked at now, and we will look at what AI is capable of. So we will discuss how, in the next episode, we will discuss how the digital pathology has become the foundation for AI. We will introduce the core concepts of computational pathology. I will explain to you different types of AI models in the next episode, and no, I won't explain it in a way that it looks very technical and like a technical jargon kind of a thing. I will explain it in a way that you can understand very easily, like I did today. Whether you're a completely new AI user, or you're already exploring the applications, or you already have done some course, I'm sure my course will help you to understand it in a crystal clear way. So if you have enjoyed today's discussion, don't forget to subscribe to the www.Dr. Deepa's Learning Launch, which is my educational website, and also have a look at Path IQ, which I'm a co-founder for. And we have the next 9 episodes coming up, so stay tuned to this. Share this episode to your colleagues also. I will be uploading this in YouTube as well, so that you can share it with your colleagues who have not registered also. Even if they register tomorrow, day after, they can still look at the recording in my website. If you miss it out, then you can still look at the YouTube video, because I will be posting this in my YouTube also. So thank you all for joining me today in this exciting journey of learning the world of AI and digital pathology. Until next time, keep learning, keep questioning together. Let's shape the future of pathology, and see you in the episode 2. So is there anything that I can answer, any questions if you have? Wonderful talk. Looking forward for next episode is what Dr. Somnath Ghosh has said. Thank you so much. I hope you like this video, and I will be sending you the next video soon. So I will be again having a live class. So thank you all for joining. This is Dr. Deepa signing off today. Bye-bye. If there are any questions, please type on the chat window. I'll just stop recording while you guys can still chat with me.